All right. Hi, good morning. My name is Christine Tran. I'm one of the Pediatric Epilepsy Fellow. And today I will be giving a talk on what to expect when you visit an epileptologist. Okay. And can everyone hear me okay? I think so. Okay. All right. So first off, let's go over what is an epileptologist. So a pediatric epileptologist or epilepsy doctor is a pediatric neurologist that has a special focus in epilepsy. So a pediatric epileptologist has completed training in child neurology. So after med school, we go into child neurology residency, and that entails pediatric and child neurology combined years of training. And so we do a residency in pediatrics, and then we complete our training in child neurology. And then a pediatric epileptologist, after finishing residency, does a fellowship that's either 1 or 2 years in epilepsy. And that's when we concentrate primarily on epilepsy and also learn how to read EEGs. A pediatric epilepsy doctor usually sees children with medically refractory epilepsy, so children who have epilepsy have been on medication that were not, their seizures were not able to be controlled on the medication. But we also see new onset seizures, and also we've seen second opinions, but for the most part, we treat children who have medically refractory epilepsy. So who should see an epileptologist? So most children with epilepsy do not need to see an epileptologist. Seizures are the bread and butter of child neurology. And so when a child has seizures, a lot of the times they can be seen by a general child neurologist, because during residency, we see a lot of children with seizures. So just seeing a child neurologist should be sufficient. However, 10 to 20% of these children who have been diagnosed with epilepsy are drug resistant. And so that means they failed at least 2 or 3 drugs. And so at that point, that's when it would be beneficial to go ahead and see an epilepsy specialist. So what does an epileptologist do? So one of the first things that we do is either confirm whether the child are having seizures or not. A lot of times patients come in and they describe they're having some abnormal movements, but it's unclear whether or not they're seizures. And so one of the first things we do is confirm whether these abnormal movements or seizure concerns are in fact seizures. And then if they are, one of the things we do is work them up and see if they have the diagnosis of epilepsy. The other thing we also do is to give these patients seizure control. So our goal is always to have no seizure. So seizure freedom is always the ultimate goal. And sometimes we're not able to get to that point. So we try to best control these seizures and give them a quality life. And then a lot of times what we're able to do and what maybe other general neurologists are not able to do is give other treatment options besides medication. So what are the treatment options that we can do? One of the options, medication. So there are a lot of anti-seizure medications out there. A lot of times when we see children, they're already on 1 or 2 and failed. And a lot of times the general neurologist may not know where to go next, but coming to an epileptologist, we have a lot of medication that we can try. The other things that we can do, we can also try a diet therapy. So the ketogenic diet is an option that we can give to patients who have failed medications. Another thing we can also provide as an option is something called the vagus nerve stimulation, or the VNS, and that's something that I believe you'll also get a talk on later on in the conference. So VNS, and also as well as the responsive neurostimulation, or the RNS, are both implantable devices. So the VNS is something that's implanted in the chest wall, and what it does is it stimulates a vagus nerve to better control seizures. And the other device, responsive neurostimulation, and the RNS, is something that's implanted in the brain that detects brain waves, and the object of the RNS is to detect brain waves that's different from normal brain waves, and once it detects abnormal brain wave that could indicate seizure, and the goal is to stop the seizure before even the patient may notice. And the other option that is also a topic that will be discussed later on is surgery. So surgery is an option that that an epileptologist may be able to provide as well. Oh, and please feel free to stop me if there are any questions. Okay, so the tools used by an epileptologist. Oops. So when you go into, when you go in to see an epileptologist, usually the first appointment is long, about an hour, and a lot of times it's going to be a lot of chatting. So we are going to talk about the extensive seizure history, the family history. We're going to do a very long interview with the patient and the family, just to get an understanding of when seizures first started and what they look like. After that will be a physical examination. We also use our EEG as a diagnostic tool. Sometimes if they have not already gotten imaging, we'll also offer brain imaging, like an MRI. And then lab work is also something that we also can check. Genetic testing is also part of the work that we offer some families if we think it will be helpful in diagnosing epilepsy, or maybe it may help, for example, us determine what medication may be best in treating that certain epilepsy. And video recording. So this is a very useful tool. So we have video recordings on when we do our EEGs, but also looking at video recordings from family is super, super helpful, especially in families with a patient that has a lot of different seizure types. It's really hard to describe seizures sometimes. So I think having any video recording of their seizures can be super beneficial. Okay, so how to prepare for your appointment? I think keeping a diary of seizures can be very helpful, especially if there are a lot of events. It's really hard sometimes when you're talking to the doctor to kind of think back of when the first seizure was, or how long the seizure, or what your child may be doing during the seizure. So I think if there is a diary or a notebook of just writing the time down, writing a short description of the seizure, how long it lasted, can be very, very helpful. It can make the appointment much more efficient when you bring that along. And along with that, knowing maybe potentially any triggers. I've had some parents who've noticed that, oh, my child, all his last 3 seizures happened after he played soccer, or it happened right after he was on the TV playing video games. So knowing or identifying any triggers could be helpful. And I think a lot of the times when you have a diary, it can help you when looking back, identify triggers or patterns that may be unnoticed prior. And also if there's any medications the child has been on and if it was effective, or if there were any side effects, that's also very beneficial, because if we know a child has tried certain drugs or medications, and it's been known that it wasn't helpful, or maybe it was helpful, but the side effects were just too severe, we definitely wouldn't want to put the child back on that same medication, because there's so many different medications out there that we can try. So knowing that information and sharing it with your doctor on your first visit is very helpful. Again, any video recording of seizure is very helpful. I know a lot of family, it's very scary, especially the first few times when your child seems to kind of take out your phone. It feels unnatural to do it. But most of these patients, family realize that, their child, once they're safe, taking out a phone can be pretty easy, because everyone has a phone now, and recording it. Especially again, if there are many different seizure types or things that you're just not sure of, it's very helpful just to do a quick recording to show your doctor. Any details of any prior treatment, like even in the emergency room or outside hospitals, can again be very helpful. Any prior workup at other institutions or other outside practices, we would also like to see that. We wouldn't want to repeat anything if we don't think it's necessary. So it's helpful for us to review these documents so that we don't redo the same thing that's already been done if we think it's sufficient. And then I will say that being on this side of it, I know a lot of parents have tried sending their medical records, like they'll call in, they'll send it, and for some reason or another, a lot of times it's not there by the time they come for this first visit. It might be, a problem with uploading it, and so I think it's helpful when I advise all my families to have the medical records with you, like hard copy with you, when you're coming to visit, just in case the medical records were not able to be sent or faxed over in time. So I think that's always a good backup plan to have. And I think preparing any questions you may have in advance is very helpful. There's no wrong questions, and rather have my families kind of have all their questions answered at that visit, so it gives them more reassurance and peace of mind. But of course, if things come up and you have questions after leaving the visit, you can definitely always email us or call in for any other concerns. But I think just writing it down and coming to the appointment with questions is helpful. Sometimes just, when you're going to family visits or patient, being on the patient side and going with my family to their doctor's appointment, I know that sometimes in the moment it's hard to think of the questions that you had before. So writing it down is helpful. And these are just some of the common questions that will be asked. A lot of these questions will most likely be asked if you've already seen for example, like a general child neurologist, or this may be your first time seeing any neurologist and it just happens to be us. These are the questions that will get asked. So when did the seizures start? We definitely want to know what age the seizures start. And if you can't recall, just even knowing just general ballpark dates is also helpful. What do the seizures look like? So again, this is always a little bit hard to describe. So if there are any videos at all, it's very, very helpful. And sometimes, the description when hearing it may look a little bit different than video, just because again, seizures are just hard to describe. So any video is very helpful. Any triggers or pattern to the seizure. So that's when the seizure diary comes into play, can be very helpful in identifying any triggers or pattern. Some, for example, seizures are nocturnal, so it occurs at nighttime, and that information helps us also with diagnosis. Some patients may say that once they're near or around their menstrual cycle, they've noticed that could be a trigger. So that's also helpful. Is there a warning or prior to seizure? That's something that your child might tell you And again, that information helps us points to a diagnosis or a location of where the seizure might come from. Are there any risk factors for seizures? So you'll be asked about, the family history. Are there anybody in the family with seizures, mom's side or dad's side? Are there anybody in the family with epilepsy in childhood versus adulthood? Are they on any medication for it? How easy or hard are these seizures to control in those that have epilepsy? So I think that's actually something that you can ask the family, the extended family. A lot of times, it's hard to kind of get, that information off the top of your head. But when parents have started asking, they realize, oh, I had a cousin or somebody on this side that have seizure they didn't know about. So that's something that you could do beforehand, is to ask your family on either side to see if there's anybody that has seizures. Also, siblings, are the siblings healthy? Do they have seizures? And then how often are the seizures occurring? So again, that kind of goes back to how helpful the seizure diary is, because it's just really hard, to kind of think back and quantify seizures or events if they're happening a lot. So again, that's when the seizure diary is super helpful. Are there any current medications or prior medications that the child has tried? And were there any side effects, or were they super helpful? So that's also, again, something that that you want to jot down or remember. And also, have there been any prior EEG studies or brain imaging? And for the EEG studies and especially the brain imaging, you can request it to, you can request the imaging to be put on a CD, so we can also upload it to our system, and that is helpful, so we can review it and see if, was the quality sufficient enough, or do we need to repeat any EEG or brain imaging studies. And so after having a long discussion with your doctor, they'll offer you a workup or treatment plan. So brain imaging, so maybe the child has never had brain imaging, or the brain imaging is old, or maybe it's not the quality that we would like. So we may also order another study, EEG study. So maybe the child has never had EEG studies, or maybe it was a long time ago. We may also order EEG studies, and there are different types of EEG studies that can be done. So one of it is the routine EEG studies that can be done as an outpatient. So the child would come to the clinic, get the EEG. It could be an hour to 4 to 6 hours here in the clinic, and then afterwards you would go home. And I think the ambulatory EEG was something that Tanya and Andrea talked about. So that's something that you would come here, it would get set up, but then the child would go home with it, and we would record for up to 3 days, and then you would come back to the clinic, and the EEG would be discontinued and taken off, and we would review it. And then there's also admission to the epilepsy monitoring unit, where you would come in and stay. Could be 24 hours or up to almost 2 weeks, depending on what's needed. Both the routine and ambulatory EEGs, we wouldn't make any medication adjustment, or we won't taper off the medication. But in the epilepsy monitoring unit, if we needed to, we could taper the medication to capture seizures. And that's one of the benefits of being able to go to the epilepsy monitoring unit. A lot of the times the routine or the ambulatory EEG may suffice, but a lot of times the question is, are these certain events that parents are describing, are they seizures? And the routine and ambulatory EEG, for example, may not have captured the events in question. So the question remains even after we do the routine or ambulatory EEG. And that's one possible reason we may say, hey, let's just check you into the epilepsy monitoring unit to try to capture these events, because the benefit of being in the EMU is you're able to stay longer, we're able to record you for longer. And And then we can also taper the medications if needed. And then another thing your doctor may suggest is seizure medication adjustment. So maybe the medication your child is on is beneficial, but maybe the dosage is not therapeutic. So in children, we dose by weight. So maybe your child may have grown a little bit, may have outgrown the dose. So we may just adjust the dose if the medication has been effective and there wasn't many side effects with it. Or we may say that, well, based on the brain imaging or the EEG, we maybe need a different type of medication. For example, maybe the medication your child is on is more for generalized seizure, but your child has what sounds like more focal seizure. We may switch medication to try to treat the seizures better. And then your doctor may also order labs, so electrolytes, CBC, liver enzymes. So some of the medications that we use can affect your labs, and we want to make sure your labs are looking good. And so we may check these things. Vitamin D level, it's good. Vitamin D is good for the bone, but also for the brain. So we also want to make sure the child's vitamin D levels are at a good level. We may also want to check medication levels to make sure it's at a therapeutic level. And then genetic testing is something that we don't always offer with every patient, but for the patients that we think may be helpful, that's something that we also may offer if we think it's going to help with either the diagnosis or the treatment plan. Other things we may suggest. So, for example, we've had patients where, around girls around their menstrual cycle, their seizures may increase in frequency a lot. So in those cases, we may refer to an OB-GYN to talk about hormonal interventions to help regulate the menstrual cycle to help better control the seizures. If a child is or has an RNS or a VNS implanted, we also could potentially make adjustment to it to better control the seizures. We also have dietary counseling. So some of our patients are either on the modified Atkins diet or the ketogenic diet, and we have great dietitians here who can look at their diet and can help families with the dietary counseling. And then sometimes after hearing the family talk about these events the child may be having, we may suggest like a sleep study. Not all events are seizures, and so sometimes we may think that maybe this has something to do with a sleep disorder. So sometimes a sleep study is a study will suggest to rule that out. And then sometimes maybe we captured a few events, or maybe we've saw a video of the events and captured it, and it's non-epileptic. At that time, we may suggest a referral to a psychologist to help with these non-epileptic events. A lot of times, these children are not aware of the underlying stress that's often associated with the non-epileptic events, and that's why a psychologist referral is helpful in those cases. And those are some of the treatment plan that your doctor may offer after the first visit. And then after the first visit, we'll of course want to have a follow-up visit after, maybe the EEG, the MRI, all the studies and workup has been completed. And then at the follow-up visit, these are kind of the common questions your doctor may ask. So we'll want to know how many seizures since the last visit. Has there been a reduction in seizure? Has there been an improvement in seizure control? And again, this is where again this seizure diary is super helpful. And then what do the seizures look like? What types of seizures is your child having? Are they the same type of seizure? Are they different? If someone comes in and they've always had a certain type of seizure, has had their workup done, we've captured it, but then comes in, for example, and has a different type of seizure, that makes me think, well, is there something else going on? And then that makes me consider repeating like an EEG, for example. So knowing the types of seizure and if there's been a change in type of seizure is helpful. Of course, we want to know if there's been any improvement in seizure control, in mood, in sleep. Hopefully there is. I talked about the side effects of medication, and then mood and sleep. And then, of course, we also want to know how school is going. I think seizure burden is hard for kids, especially when they're going to school. A lot of times school is affected when seizures are not well controlled. And medication can also affect learning. Certain medications can. And so we want to know how the child is doing in school. And if, for example, the seizure medication is controlling the seizure, but is causing the child to not learn as well or be as interactive in school, we also don't want that either. So even if the seizure is controlled, we may still change the medication if it's having significant side effects, and especially causing it harder to learn and participate in school. So we'll definitely want to know that. Then we'll ask you, are there any concerns at all? Any questions at all? Again, there's no wrong questions. We definitely want to hear any concerns you may have. So again, bring any concerns, questions with you, or write it down with you prior to the visit if you have time, so they can be addressed. And then that's like a quick summary of what it's like to see an epileptologist for the first time. And then right now I will open it up for questions if there is anyone out there that has any questions. Let me check the chat to see. Okay, well, I don't think there are any questions in the chat right now. So thank you for participating. And I guess we have a little bit of a break before our next one. So again, thank you for joining us today.